next speaker is Francisco Molinet from the CIIIEN, University of Navarra. Thank you.
Thank you for the opportunity of presenting this work here. Parkinson disease is a neurodegenerative disorder characterized by progressive loss of dopaminergic neurons in the substantia nigra, causing dopamine depletion in the striatum. As you can see in the figure, in the upper figure, PET imaging allows to follow up the evolution on patients at basal states and pre- and post-clinical stages. This triggers a succession of compensatory changes, delaying the appearance of motor manifestations, leading to a prolonged presymptomatic period of disease evolution. The aim of this neuroimaging study is to characterize and define in vivo a state course pattern of functional changes associated with dopaminergic striatal reduction in the MPTP monkey model of Parkinson's disease using positron emission tomography. In this study, 24 monkeys were administered MPTP using a low-dose regimen of 0.5 milligrams per kilogram weekly to obtain a partial, slowly progressing degeneration in the nigrostriatal projection. Before the first MPTP administration, and when a stable state was established and assessed by current scale, dihydrotetrabenazine and fluorodeoxyglucose PET scans were carried out to study the monoaminergic and metabolic functional stages respectively. Here you can see the video of the time course evolution of this progressive MPTP model. This is the basal state, and as you can see, this monkey can be freely moving and without any problem. The same happened with the asymptomatic states. This is the current scale at 0. As you can see, it also moves. The recovered monkey is a monkey that has been previously Parkinsonian, has received the good amount of dose for being Parkinsonian and then recovered. This is the mild Parkinsonian monkey. You can see that start having a bit some problems at the moment, a bit of tremor, and this is the severe Parkinsonian group, which has a current scale upper from 16. You can see him very quiet, the state, and you can appreciate the tremor in the hands and the legs. This is the evaluation. This study enlarged the N of animals and PET scans to provide a very robust statistical assessment. As you can see, we have carried out 72 PET scans of dihydrotetrabenazine and 70 of fluorodeoxyglucose. These are representative reactivity images of the same monkey made by dihydrotetrabenazine and fluorodeoxyglucose. The upper line represents the baseline state, and in the middle you can see the corresponding images to the Parkinsonian stage. Dihydrotetrabenazine images were processed to obtain parametric images of the binding potential, and fluorodeoxyglucose images were compared within groups using voxel-based statistical parametric mapping software. These are the monoaminergic results. Parametric images showed a progressive decrease of binding potential values in the striatum throughout the ensuing of Parkinsonian signs in each state. Dihydrotetrabenazine predicts nigrostriatal lesion as established by histological correlation previously defined by Dr. Blesa in our group. It is remarkable that dihydrotetrabenazine PET images showed that a spontaneous motor recovery can occur in monkeys despite large dopaminergic striatal loss. These are the metabolic results. Fluorodeoxyglucose PET in the moderate Parkinsonian state was characterized by reduction in posterior parietal and temporal lobe, as well as increases in the GPI. Severe Parkinsonian states included same areas and extended reductions in posterior parietal, temporal lobe, lateral premotor, and frontal cortex, as well as increases in the thalamus, globus pallidus, and cerebellum. After L-dopa administration, FDG revealed a metabolic pattern recognized by hypometabolism in posterior parietal occipital region and hypermetabolism in postcommissural putamen. The FDG PET pattern of severe Parkinsonian monkeys and after receiving acute levodopa treatment resembles and mimics one characteristically found in PD patients by Heidelberg's group. As we have just seen in the severe Parkinsonian monkey, patients also showed metabolic increases in GP, thalamus, and cerebellum, as well as metabolic decreases in premotor cortex and parieto-occipital cortex regions. A subgroup of severe monkeys were led to evolve for many months after the last MPTP injection and recovered fully. However, binding potential dihydrotetrabenazine values remained within the Parkinsonian range, while FDG PET became nearly normal in keeping with the behavioral evolution. This suggests a powerful extrastriatal compensatory mechanism that can be further studied in vivo by PET and other techniques. We think that this motor compensation is related with no striatal mechanisms. To conclude, dihydrotetrabenazine PET is a sensitive method to ascertain different degrees of dopaminergic depletion in the MPTP monkey model. We have found that motor recovery can occur in monkeys despite large dopaminergic striatal loss. The Parkinsonian states are associated with a well-defined metabolic pattern and hypohyperactivity at cortical and subcortical structures. The different degrees of striatal dopaminergic depletion are associated with distinctive degrees of metabolic changes. The metabolic pattern characterizing the Parkinsonian state shares high resemblance with the changes present in PD patients. Specifically, cortical hypometabolism and thalamic and GP hypermetabolism are clearly recognized in both the MPTP model, monkey model, and PD patients. Thank you very much.
Thank you very much, Francisco, for your perfect timing. We have time for one or two questions. Nobody?